Hey guys, this is Michael, your respiratory therapist and trainer, and today we're going to talk about how to set up your circuit for the CrossVent 2i neonatal transport ventilator. This of course is the machine you're going to use to ventilate and provide flow to any of your neonatal patients who will fit in the isolette, which of course is 6 kilograms or less. First thing you want to do is unpack your circuit and identify all the parts and what's going to connect to where. So part A, you see in your diagram there, is going to be the patient connector. So that's going to connect to whatever interface you have on your patient, whether that's the ET tube, the CPAP nasal prongs, or the high flow nasal cannula. B is going to be the fresh gas connector that goes into the ventilator. So that's the other large bore tube, which is going to fit actually to the ventilator part, which is going to provide that gas to your patient. C is the pressure line, which is going to regulate your peak pressure and monitor those things. And then D is going to be the expiratory drive line, which is going to help to monitor and regulate your PEEP. You'll notice that your drive line, your expiratory drive line, and your peak pressure line look very similar. What's going to separate those two, of course, is that big expiratory valve that you see in the diagram. Next thing you want to do is identify the parts on the ventilator connection and the corresponding parts for the circuit. So part A on the ventilator connection is going to be where the fresh gas connector goes. So that large bore tubing is going to fit onto there, which is where the patient flow is going to come from. Part B is the pressure line, and then part C is going to be the expiratory drive line. Again, you'll see those look similar. What separates them again is that expiratory valve. Once you get those parts identified, get them hooked up correctly, decide what mode you're going to want to use, what modality you're using, whether that's an intubated patient or CPAP or high flow cannula. And then before you hook it to the patient, hook it to a test lung, and then you're going to get your settings plugged in based on whatever you want or whatever the provider tells you, and get those things set up right on the test lung. And then before you connect it to the patient, confirm that they are working the way that you want them to and that they're appropriate, and then go ahead and fit that interface to the patient, connect the circuit to that interface, and then confirm that it's fitted correctly and the patient is ventilating appropriately. That pretty much covers everything for connecting the circuit. That's a pretty simple step. Next thing we'll talk about will be actually setting up the ventilator for what you want to do, whether that's invasive ventilation, CPAP, or high flow nasal cannula. Make sure your settings are correct and that you are ventilating and oxygenating the patient appropriately. Thanks.